Well, it is Monday, of course, and you know what that means. We have a doctor right here in our Local 10 newsroom for our Monday morning house call. And this morning, we have pediatrician Dr. Alan Lewis from the Children's Medical Association joining us to answer all of your questions. Good morning, doctor. How are you doing today?
Good morning, Christy. Thank you. I'm doing great. Thanks for having me here.
Yeah, glad to have you here. School starts next week, so what should parents be making sure they get done this week to ensure that their children are healthy and ready for class?
Great question. This is always a busy few weeks for us before school starts. Lots of checkups have been scheduled, and parents are trying to get in quickly to get their kids in, to get the shots up to date and do their sports physicals. So that's definitely a big time for us as pediatricians.
I'm sure. Yeah, I did the sports physical for my son last week, and my daughter has a physical this week, so I'm in there with all the other moms and dads. Great. So tell me a little bit about the start of school. What kinds of things do we generally start to see the kids coming home with? Besides the run-of-the-mill colds and flus and things like that, what other problems do you see in your office?
Well, you know, they can definitely range from medical illnesses to school performance issues. Attention deficit disorder will show up, and once the teachers are finding difficulties with kids. Anytime kids are in large groups together, viral diseases tend to spread much more easily. So we see a lot of stomach virus, vomiting and diarrhea, and the colds, like you said.
All right, can't stress enough that hand washing, right?
Absolutely.
All right, well, I know that you're going to be here with us for the next hour chatting with folks on the web. So you can ask our viewers, the doctor, any of your pediatric questions right now on our website, justnews.com. We'll be answering all your questions until 10 this morning, and I'll come on out to the newsroom in a little bit to talk with you some more and find out what our viewers are asking you. Thanks a lot, doctor.
Great, you're welcome.
Okay. All right, I'm out in the newsroom right now with our Monday morning house call. Again, Dr. Alan Lewis is joining us from Broward Health. Nice to see you again. So tell me about some of the things coming across our web chat. What are the questions that you're getting asked this morning?
Quite a few questions on constipation in children. And constipation can be a minor nuisance, or it can actually be something quite serious. That can be a vicious cycle. If things aren't changed, they can lead to more problems that are difficult to treat.
What kinds of changes might somebody want to make in the diet at home?
Diet is very important, just like you said. So many times too much milk can constipate. So when kids have more than 16 or 18 ounces of milk per day, that can actually constipate. Not getting enough grains, fruits and vegetables is also very important. Drinking a lot of water. I don't usually encourage juices, fruit juices, but in cases where there is constipation, sometimes adding some fruit juice in limited fashion can be helpful.
Right, and you also had a question, I know, about fevers, and that's always a touchy subject. You know, we never know exactly when we need to take our child to the doctor for a high fever.
That's a great question. Times have changed a lot over the last 10 to 20 years because of immunizations. We have immunizations that protect against those serious diseases that used to worry us when kids got fever. So fever is much less worrisome than people used to think. Age is very important. Kids under 3 months of age with a fever should always call their pediatrician right away. Over 3 months, it all depends on what's going on, whether there's a cold, runny nose, cough, when the fever and the illness comes, but those are all very important things to think about.
And we talk a lot about colds and fevers and flus and things like that, especially this time of the year when the kids are back in class and they're spreading those kinds of things. But it's also important to remind moms and dads that not everything needs an antibiotic.
Absolutely. That's a great question, Christy. My responsibility as a pediatrician is to be able to differentiate when that kid comes in with a cold, when they need antibiotics and when they don't. Most colds are viral, which means they don't need antibiotics. Green and yellow doesn't mean they need antibiotics. It's more the duration of the symptoms. Colds can last 10 to 14 days and still be viral. When fever comes late in the illness, that's an important time. They may need antibiotics. Ear pain, they may need antibiotics. It's very, very important. And I must say, parents are much better educated today than they were 10 or 20 years ago, and understand and are not so demanding of antibiotics, and really understand that kids are going to get better on their own in many cases.
Yeah, so often we just want a quick fix and hope that the antibiotic is going to be just that. And you mentioned ear pain. That's really big right now because so many of the kids have been in the pools, at summer camps. A lot of swimmer's ear out there.
A lot of swimmer's ear. Easy to tell when it's swimmer's ear. If you push on what's called the tragus, this little button over here, if that hurts, or pull on the pinna, this little thing over here, if that hurts, it's probably going to be swimmer's ear. And usually it's in the absence of cold symptoms. Okay, so without cold symptoms, ear pain that hurts when you touch it, probably swimmer's ear.
And what do you do to get rid of it quick?
Well, many times we need a prescription antibiotic drop or an anti-inflammatory drop, and that's something your pediatrician can help you with.
All right, well, I'll let you get back to the web chat right now. And if you have any questions, again, for our pediatrician, Dr. Alan Lewis, thanks so much for being with us. Just log on to justnews.com and ask away. It's free. That's always a good thing. Baron?
All right, Christopher, we like that. Thank you so much.